Hello, my name is David Horsburgh, and I'm the lead author of the paper entitled Growing Risk Avoidance in Asia Oncology Site Selection and How Trends in Site Selection Are Limiting Growth of the Asia Cancer Trial Landscape. Between 2000 and 2012, Asia witnessed a dramatic increase in demand for clinical trial facilities, also known as sites, with oncology studies being one of the key driving forces behind this. This has seen a significant impact on the availability and selection of both clinical trial experienced and clinical trial inexperienced or naive sites. Given the perceived risks with selecting and activating naive sites, this study looked at recent trends in site selection and how these risks have been managed during EZ's expansion into the global trial landscape. Using data collected from 140 oncology trials, we looked at a number of specific trends, focusing on the number of sites activated per year. As expected, that increased demand for study locations stimulated growth in the number of sites overall. However, we also saw a significant decrease in the contribution of naive sites to new studies within the region. In fact, by the end of the observed period, less than 20% of all sites activated would have been classified as naive. What this data highlights is that there is indeed a strong selection bias towards experienced sites over naive sites in the region. The key reasons for this bias are likely to be the lower recruitment rates, longer startup timelines, and quality risks that are often perceived to exist with these new sites. The current management strategy for these additional risks appears to be reducing the number of naive sites utilized to the absolute minimum, with successful study delivery being almost entirely reliant on previously utilized sites. This raises the question of how our site pool in Asia is expanding to handle the increasing demand if we are targeting the same sites over and over again. At a critical point, general capacity from these sites may be reached, and it will be necessary to reach out to additional new sites and grow the site pool. Interestingly, our data shows that as a result of the experienced site bias, this does not occur in a consistent manner. Instead, what we see is a pattern of sudden fluctuations. Site pool growth is typically below the rate required, and once capacity is reached, a large and sudden outreach of two naive sites is necessary to cater for additional trials. Clearly, quality, safety, and performance are vital factors in site selection. However, with the current level of risk aversion and bias towards reusing the same trial sites, it is simply not sustainable in a region experiencing the level of growth present in Asia. In the site selection community, we may need a mindset change away from the current cycle of low risk followed by sudden high risk. One possibility would be to expand the site pool through the consistent inclusion of a number of naive sites, combined with correct training programs and oversight. Such a strategy would allow for an appropriate balance between naive site risk and overall site pool growth. And when considering the development of Asia as a region over the next few years, it will be important to start phasing out that short-term safety for the concept of long-term sustainability.